We all have the right to make our own healthcare decisions, choices about the types of medical treatment we want or don't want to receive. These choices are very important when you have a serious life-limiting illness and aren't expected to recover. Thinking about how you would like to spend the time at the end of your life is hard, but learning about your options, organizing your thoughts, and planning ahead can give you and your family peace of mind, especially if you aren't able to speak for yourself. I'm Dr. Susan Nelson, and in Louisiana there's a special document and care planning order set for people who have serious advanced illnesses like cancer, congestive heart failure, AIDS, dementia, and ALS. It's called the Louisiana Physician Orders for Scope of Treatment document, or LaPOST. LaPOST is more than a living will or healthcare power of attorney. Let's learn more about how LaPOST works and how it can help you get the care you want in the place you want to be.
What someone needs to know about LaPOST who has a serious advanced illness is that this document is totally voluntary. It is a physician's order. It is discussed with you and your physician and your loved one because it really customizes what your wishes are.
It also is a paper document. It can sometimes be printed out on a gold paper or it can be done electronically. The one main thing with this document is that it is to follow the resident from healthcare setting to healthcare setting, wherever they go, to the ER, to the hospital. This is to go with them.
Completing the LaPOST document begins with a very important conversation between you and your doctor and other members of the healthcare team. The discussion can help you and your caregivers better understand your illness, treatment possibilities, your preferences, values, and goals of care. While you may have this conversation with others on the team, only a physician may sign the order form.
The conversation between the resident and the physician is so important because you're letting your wishes be known. Plus, it gives the physician and the resident the opportunity to discuss each section and to customize those sections of what your wishes are. And at that time, that you can also review the document, with the social worker, other members of the interdisciplinary team, to help you better understand what maybe your changes and conditions might be in the future.
It is important for the family or the resident to ask questions. What does this mean to me? How will this affect me at the end of my life? And what will go forward? And these questions can be answered when the team gets together.
After the conversation is held, it's then time to fill out that document and go ahead and with your physician there is complete it. If you're unable to talk, if you have a resident who's unable to talk for themselves, is getting their healthcare power of attorney to complete that document along with the physician and have the physician to sign it so it becomes that physician order. But filling it out is the most important thing.
A completed LaPOST document becomes your roadmap for medical care and must be followed by all healthcare professionals. It represents preferences based on your current condition and illness. But what if you change your mind about some or all of your treatment choices? What if your healthcare status changes? How is the LaPOST document reviewed?
After the LaPOST document is completed, it is vital that this be regularly reviewed by the team members, and this can be reviewed with the resident. One of the main times is during the quarterly staffing in a nursing facility, but also when there is a healthcare setting change or health status change. This LaPOST document should be reviewed with the resident or the family members.
Also, whenever the resident wants to change it, it can be changed voluntarily with the resident, and it just has to be reviewed with the physician and also signed.
As mentioned earlier, once it's completed and signed, LaPOST becomes part of your medical record and transfers with you from one healthcare setting to another, including emergency care and during transport and in between. Having access to this information, whether it's documented on the bright gold-colored paper form or in an electronic form, enables healthcare professionals to respect and honor your end-of-life goals of care, anytime, any place. It also helps you share these decisions with your loved ones. I hope we've answered some of your questions about LaPOST and how it can help you receive the kind of care you want at the end of your life. If you have more questions, please check with your doctor and your healthcare team. And if your family members or caregivers would like additional information, the LaPOST website la-post.org is another helpful resource. Thank you for watching.